In the early 1900s, the Yazoo and Mississippi Valley Railroad cut straight through Baton Rouge on its way to Memphis, Tennessee. On one terrible day, a train derailed in downtown, leaving scores of railroad workers seriously injured. Dr. T.P. Singletary, a pioneering local physician, immediately raced to the scene and took the injured workers to a nearby building to administer care. In the wake of the tragedy, Dr. Singletary realized just how much more efficiently and effectively he and other physicians could treat patients if they were all under one roof. After that day, he set out on a mission, and by 1908, he'd built the 3-story brick hospital that would become Baton Rouge General, an institution that has been at the heart of this community ever since.
In a critical incident, it's not so much what you do, it's how quickly you do it. And the same thing applies when you've been injured. You need care immediately. And the quicker you can have that care done, the better it will be. That's what this facility will do. That's what the RISE campaign is about.
We have always treated our patients like family and welcomed their family in, and that's kind of one of the things that makes us different. We are soft and caring and warm with our patients, but when it comes to the technology, we're dead serious. We just don't show that side.
As a fully independent nonprofit hospital, Baton Rouge General always prides itself on being a hospital of firsts and a leader in healthcare innovation. In 1974, it made national headlines when Dr. Gene Berry successfully implanted a pacemaker in then 5-day-old Amy Skipple. It was also the first hospital recognized by the American College of Surgeons for having a community hospital comprehensive cancer program in 1987. At every turn, Baton Rouge General has been there for the residents of South Louisiana and beyond. To this day, we are committed to meeting the ever-changing healthcare needs of the community and leading the region in exceptional patient experiences. In 1970, Baton Rouge General listened to the needs of the region and established one of the nation's very first burn centers. To this day, it is the only burn center verified by the American Burn Association within a 300-mile radius of Baton Rouge, treating 1,000 patients each year from across the region, and in some cases, from around the world. In 2020, again responding to the needs of the region, we will build a new state-of-the-art burn center equipped with family-friendly inpatient suites, a pediatric playroom, and private rooftop therapy garden. It will also contain the best-in-class outpatient treatment spaces with brand new treatment rooms, a fully equipped rehab gym, and an interactive technology suite. For the past 30 years, the Baton Rouge General Pennington Cancer Center has provided first-class treatment and compassionate care. From diagnosis to recovery, our expert teams have guided thousands of patients every single step of the way during their journey. To ensure we remain at the forefront, we're investing in even more superior technology. A new PET CT scanner, giving our teams access to the most advanced diagnostic imaging available. A new linear accelerator, allowing us to perform even more life-saving radiation treatments. New Savvy Scout technology to make lumpectomies easier to perform, easier on patients, and even more successful. And an advanced biopsy table for minimally invasive targeted procedures. For all those touched by cancer, this means earlier detection, advanced treatment, and faster recovery, with the comfort of being able to remain close to home. Last year, almost 25,000 patients traveled from Ascension Parish to Baton Rouge General for care. In order to provide for its current and future residents, Ascension Parish needs a solid foundation for primary, urgent, and emergency care locally. This is why we are building the new Baton Rouge General Neighborhood Hospital there. Opening in 2020, the 42,500 square foot centrally located facility will include a 10-bed inpatient hospital, 14-bed emergency room, and a state-of-the-art lab, along with primary care, outpatient rehab, physician practices, and office space.
What's exciting to us about this is this is going to be a neighborhood hospital. It's a micro hospital. It's a small hospital. It's going to have all the things that a larger hospital has to treat emergency care.
Once construction is complete, the hospital will provide care 24 hours a day, bringing high-quality treatment for families and creating a new patient experience, thanks to an easy-to-navigate campus that makes use of the latest patient experience technology. As technology improves at a rapid pace, more and more treatment can be delivered on an outpatient basis. To provide patients with the greatest access to care, Baton Rouge General is renovating the 140,000 square foot building next to the main hospital on our Bluebonnet Boulevard campus. Opening in 2020 and expanding by nearly 12,000 square feet, the Baton Rouge General Center for Health will include a 6-suite outpatient surgery center with the latest in surgical specialty equipment and robotics. It will also house physicians' offices, clinic space, and outpatient rehab services. And will be the new home for Baton Rouge General's award-winning graduate medical education program. Dr. Singletary realized just how much more effectively patients could be treated if they and all of the physicians, clinics, and facilities they needed were all under one roof. Building Baton Rouge General was his life's work. Continuing his life's work is ours.